Last night we showed you the challenges people with disabilities are facing when they try to see their doctors. And we also told you why doctors say it's a challenge for them too. Tonight, CBS 2's Audrina Bigas goes farther to find solutions and tells us what both doctors and patients say needs to be done.
I have avoided going to the doctor because sometimes I know that it's just going to be trouble or more aggravation.
From her accessible transportation running late to making a doctor understand her special needs, Chernelle Lane says sometimes it's just easier to stay home and suffer than navigate her way to and through a doctor's appointment.
People with disabilities are facing discrimination when they're trying to make appointments with doctors.
Over the course of more than 10 years, Dr. Tara Legou has been advocating for patients with disabilities, especially those who use wheelchairs. In her research, 20% of the doctors surveyed refused to treat those patients. Further studies revealed some reasons. It's more difficult, more time-consuming, plus they don't have the facilities to accommodate them.
This, your typical exam room. But if you're in a wheelchair, how do you and your doctor comfortably fit in here?
It's not only a lack of space, but a lack of proper equipment and staff.
If you are going to transfer a patient who uses a wheelchair, you need additional staff, you need the right room, you need a height adjustable table, you need the training.
We headed over to the Shirley Ryan Ability Lab in Streeterville to check out some specialized spaces and equipment. Dr. Allison Kessler says making even some of the accommodations they use here can make a big difference. First, larger exam rooms.
There's a wide enough turning area so that an individual who's either using a mobility device such as a walker or a wheelchair can come into the room, fully turn around, be able to face the physician. The room is big enough also to allow both the physician to be a wheelchair user.
Once inside the room, the overhead lift system helps get patients onto an extra wide mat.
You can raise the height either up or down as needed to help accommodate a transfer onto the mat or being able to get off of the mat.
This scale helps doctors get a patient's accurate weight.
We'll weigh them in their wheelchair on this scale. Then what we do is we bring them to the room and we transfer them to either the chair, the bed, or the examination surface. And we'll come back and weigh the wheelchair separately so that we can make sure we have an adequate weight for the patient. Even just putting one of each of these devices in your facility will allow you to be able to see patients that have more mobility impairments or other disabilities.
Beyond that, Dr. Legou says we have to go back to the beginning.
We don't have a curriculum in most medical schools about how to care for people with disabilities. One of the other points that doctors said was that they don't feel qualified or trained to care for people with disabilities.
Chernelle Lane says she has had doctors who care, but they are the exception.
More often than not, you're going to get someone who is too overworked to worry about your accessibility.
So we asked her, what would she say to patients?
Advocate. Don't be afraid to advocate for yourself. Speak up.
Audrina Bigas, CBS 2 News.
Dr. Legou says she is continuing to research this problem as she's working to find ways to help doctors better understand how to care for patients with disabilities.